Hey guys, this is E from Zen Creator. Today we have a special guest, my personal therapist, Jeanette, who's helped me a lot with my personal mental health. So I thought, why not have her as a guest so she can share her knowledge and wisdom with all of us. Jeanette, thank you for joining.
Thank you for inviting. It's a pleasure. I'm excited.
Same. I guess let's start off with, tell us about yourself. How long you been a therapist? How long you been in this profession? Tell us about the diagnosis on your side that you've seen the most during your career. We'd love to learn more about that.
Sure. I started in 2015, but I was officially licensed in 2019. And I've been seeing patients since 2019, 40 patients a week minimum. And I think the most diagnosis I gave, I could say 90% of my patients, I diagnosed them with depression and anxiety. Unfortunately, it is the two main and most common ones.
That makes sense. And how do you help them typically with depression, anxiety? What are the solutions you have? You can talk, maybe start with depression. It's a big one.
Sure.
And then anxiety.
With depression, I mean, there's a criteria to look when we're diagnosing someone with depression. The criteria is, the symptoms are loss of interest, loss of energy, lack of sleep, feeling of sadness, severe sadness, feelings of worthlessness, hopelessness, change in the diet, low sex drive, not enjoying the things they used to enjoy once, not being motivated to even get through their day-to-day, tasks and normal life. But when you look at those symptoms, I think I am very big on the sleep part, and I really want to rule out that before completely, starting interventions for depression. So I really explore more how these people is sleeping, the amount of time they sleep, the quality of sleep they get. And I noticed that so many of my patients, once their sleep is better and is improved, the depression literally goes, they are less depressed.
No wonder you ask me if I get my sleep or not every week.
Every time. That's the first question. I asked that question just to know, one, if you're how you slept, but then also it changes my agenda, my planning of how the therapy should. So if you didn't sleep good, I do something else. If you slept good, I do something else in the session.
So let's say that's a good way to start. So let's say that I do sleep good, but I still have signs of depression. What's next? What happens next? So sleep is the first line of attack, which makes sense, right? The science says we need to get at least 7 to 8 hours of sleep. What happens after that?
I ask people, this is the question I almost ask every patient. Maybe I didn't ask you because you are pretty expressive and you already told me everything. I didn't have to ask you, but one thing I ask people, what could change in your life today if I was a magician, or I could make your wishes come true? What would you wish to change in your life? What is it that if that had changed, you will feel less miserable, less depressed, less sad? And when people start talking about, if my husband changed, if my daughter, I'm like, forget about people. That's impossible. We cannot change them. All we can change is how you think, how you behave, how you feel. And maybe those people are going to change accordingly once you're a different person. When your behavior is changed, when you're, feeling differently towards, some people have unrealistic expectations from the people in their lives. And when I I challenge those unrealistic expectations, those negative thoughts, those generalizations they have. I don't know if you know about the cognitive distortions. I talk a lot about those. So they just start behaving differently. They have a different attitude towards life, towards their husband, towards their wife, towards their kids. But yeah, so I want them to, it goes to the situation. To answer to your question, after the sleep is improved, I want to talk about situation, your life, what's pissing you off, what's making you sad, what's making you mad, how much of it has to do with you, how much responsibility can you take? Are you self-accountable in general, or you're just gonna blame them? But because when someone's gonna blame the whole world for everything they're struggling with, it just tells so much about them and lack of self-responsibility and self-accountability.
Interesting. And how about anxiety? Tell us about a little anxiety. How do you approach anxiety? Somebody who's anxious, how do you approach that? I remember you told me in the past that there's a balance for anxiety. Some anxiety is actually good, right? Which is very interesting and unique way of thinking. So tell us more about that. Let's share with everyone on this.
I mean, over and over, they did studies on anxiety, and they found that students, when students are taking exams in high schools and even universities, they found that students with very low level of cortisol, anxiety, also known as stress,
right,
they did terrible on the exams. And it applies also to the students who had high level of anxiety, high level of cortisol, high stress, and they did terrible, even if they were so prepared for the exam. But if the anxiety was out of control, they did, because when you have so much anxiety, you forget, you can't focus, you can't concentrate. Memory and cortisol they're very related to each other. So if you have so much cortisol getting out of your brain, then you have less ability to focus and concentrate. So the students who did amazing on tests were the ones with moderate level of cortisol and known as anxiety.
Right.
But it is definitely benefiting people to be more successful, and it's just you have to be able to control it if it's getting out of control.
Fair enough. So tell us about if somebody's out of control anxiety. First of all, how do you recognize that? How do you know if somebody's out of control anxiety? And then how do you help with that?
I think once it becomes, I help people to learn and then recognize the symptoms of panic attack. So when an anxiety becomes an anxiety attack, then the anxiety is almost going towards panic attack. That's when you know, this is getting out of control. Your heart is racing really fast. Yeah. You're shaking, you're losing words, you don't want to go to certain places, you don't want to perform. And what I found the most helpful with that is mindfulness. Because remember, anxiety is almost all the time is catastrophizing the possible negative outcomes of future.
Great point. So you're always worried about the future.
Exactly. And unknown future.
And the past and concerns. That's why I meditate every day. I know exactly what you mean, about to bring you to the present.
Absolutely.
Yeah.
Brings you to besides the biological factors where, there's an oxygen flow in the brain, your more chemicals are getting balanced when there is, but in general, the fact that it brings you back to the present is the key. And another technique which I use in therapy is called grounding. Did we talk about grounding?
Not yet.
Okay, do you want me to?
Yeah, please.
Sure.
Absolutely. Share with the world. Let's talk about it.
I call it 5, 4, 3, 2, 1. So when you get very panicky and you want to bring yourself back to the present moment and you don't know meditation or you don't even remember that you should take deep breaths, just remember 5, 4, 3, 2, 1. Just look around yourself. Name 5 things you see. 4 things you can touch. 3 things you can hear. 2 things you can smell. And 1 thing you can taste.
Interesting.
all
and that,
your senses.
and that helps you with your anxiety.
Absolutely. Yes.
Wow, that's really cool.
It's grounding. It grounds you.
Yeah, again, brings you to present, right?
Absolutely.
I love it. What else do you have? This is cool. Do you have other tricks that we can talk about?
Deep breathing. Oh yeah, I do have some tricks actually. Cold water.
Also, do you think the cold plunge, that's really popular these days?
Oh, is it?
Oh my God, it's like the thing to do.
Wow.
Do you think it's because of that? It's becoming more so popular?
I mean, I tried it on a family member of mine, and that's how I discovered it works perfectly fine. I told her she has to jump. They had a pool, and she was having a panic attack. I said, if you want me to continue to be your therapist, you have to jump now in that cold water in the pool. And she did, and she came out. I said, tell me, how do you feel? She's like, great.
Nice.
So now you don't have to jump but you can hold a piece of like ice in your hand, taking shower with a bit cold water, not super cold, but drinking cold water. But yeah, I mean, I can go on and on, but I know you have more questions. So
Yeah,
I'll pause
absolutely.
there.
So just to recap, for anxiety, if you have excessive anxiety, meditation,
Grounding.
5, 4, 3, 2, 1 rule, which is basically using our senses and identifying objects around us, right?
Mm-hmm.
And then cold plunge if you want, or cold shower.
Cold water, yeah. Put it,
Cold favorite.
even just like feeling the ice on your skin, just that, or on your face. Honestly, it really helps.
Got it.
One more thing in regards to anxiety that I found it helpful with my patients. It's a worksheet. I think you guys can find it on therapistaid.com. It's a worry exploration worksheet, and what it does, it asks you, what's the worst thing that can happen?
Mm-hmm.
What are some evidence that what you're thinking is going to happen, which is the worst case scenario, that catastrophe? What are some evidence backing it up? How many times it happened in the past?
Yeah.
Almost zero. What are some evidence that it's not going to happen? Okay? And every time I do this worksheet with patients, believe it or not, the evidence backing things up towards the conclusion that what they're worrying about will not happen, it's almost 100% more those evidence versus the evidence that it's actually going to happen. I remember actually I did but we'll stop there.
Okay, fair enough. So now let's talk about, it comes to a point where it becomes like clinical, right? Beyond how much it can help. What's your thoughts on medication for depression, anxiety? What are the options for medication for both? What do you think of them? What is the efficacy of those medications and so on?
I think it was you one time you asked me depression and anxiety or like mental illnesses got worse. And I think I really believe that it's not that mental illness or the depression or anxiety got worse. I really believe that the diagnoses are more now. And the reason is because people are more aware of the mental disorders. They recognize it. Therefore, they seek help. I had a patient yesterday. She said, even today, my mom came and said, why are you taking antidepressant medication? It's all in your head. You don't need to. And I know so many of our parents had depression and anxiety, but they were undiagnosed. And therefore, now that we have more diagnoses, we think it got worse. You get what I mean?
Yeah.
I think it was always there. People had it. People suffered and struggled for decades. But because they weren't receiving diagnosis, we didn't have the data to collect how many people actually had depression and anxiety.
Interesting. It's also socially more accepted today. Like this podcast, right? I'm going publicly
Mental
talking
awareness,
about that I'm getting
absolutely.
a therapist. I think my parents would not be okay going on a live show talking about to their therapist, right? So I think people are more open-minded
Absolutely.
to share, hey, I'm not perfect, I can get better, and let me work with a professional, right? I think
Totally
that's
agree.
what also.
The same patient I was referring to, she said, while my mom was judging me for taking antidepressant medication, I was questioning her, why didn't you take me to therapy long time ago so that I could actually start taking SSRIs from then and I could have achieved much more by now.
Yeah.
So with medications, SSRIs, serotonin, I mean, it's called selective serotonin reuptake inhibitors, and they work, they're antidepressants, but they literally target anxiety. And they're amazing medications. Many of my patients, I had a patient who was pregnant and she was still taking it because her primary doctor said it's that much of a safe medication.
Wow.
So they're non-addictive, safe medication. They help with motivation level. What they do is they just help your brain to produce more serotonin and dopamine and less cortisol. Therefore, you kind of have that energy to get up and do the things you want to do. You have more motivation. Energy and motivation are kind of going, hand in hand. And I think once you have that energy and motivation, you just get things done. You are more productive. You're more focused. You concentrate better. You don't entertain negative thoughts. You don't get stuck in overthinking. It's just a beautiful medication. And one day, if I feel like I need it, I will totally, like, hey, so far I'm doing great, but
Yeah, I hear
I
you.
can't wait.
Interesting. Yeah, I'm not using it for.
I can't wait for
FYI,
this
but
to be a normal, for people to normalize it, just like they normalize vitamin D, vitamin C. I mean, people Google the side effects of Prozac and they come up with stuff. And then I send them back the side effects of vitamin C and vitamin D.
That's awesome.
They're like half of the symptoms
That's really
are the
funny.
same. Yeah.
That's really
Nausea, diarrhea, headache, stomach pain.
That's really funny. I
Yeah.
think that's important. I want you to repeat that one more time because I hear a lot from people being concerned about side effects, which is important. Of course, be concerned. But those are the same people, for example, who drink a lot of alcohol, right? And they tell me, oh, this medication.
So-
I'm like,
Yeah.
sir, you're drinking so much alcohol, which is the main problem, yet you're
It's
worried about
really bad.
taking
Exactly.
medications, right? So tell us a little bit more, one more time. I think it's important for you to share this with the audience. You talked about side effects. What are the side effects of vitamin C? You talked about vitamin C.
Vitamin C side effects. If you Google it right now. Nausea, vomiting, headache, stomach pain. So the same things you're gonna find when you. One thing I'm not gonna lie though, if you take SSRI for more than a year, the possibility of lowering your libido, your sex drive, is high. So the sex drive goes down if it's taken more than a year. That's why I encourage my patients to try to stop it, and they all did. I'm so proud of my
They're using
patients.
temporarily.
Yes.
Got it.
I mean, the max should be 1 year. Minimum should be 3 months.
Got
I'm
it.
not a psychiatrist, but according to, the research, that's what I found.
Very helpful. So tell us a little bit about what we do for a living at Zen Creator. Obviously, we work in social media, and we work a lot with content creators. So I'm curious, since the invention of social media, how has mental health changed? How did social media impacted mental health?
I mean, just yesterday I was sending it to another family member of mine that why is your child having Instagram? Seriously. And according again to research, 67% teenagers in United States right now have Instagram. And guess what? Since 2010 until now, the suicide rate of teenagers from 13 to 24
Wow.
increased by, give me a number, guess,
50%? 50?
60.
Wow. It's very sad.
60%.
Very sad. I believe it.
It's really bad.
And what was the year? What was the timeline?
From 2010 until now.
Well,
in
2010,
14,
exactly when social media started taking.
exactly. Yeah. Everyone were on
Interesting.
Facebook and then Instagram and now TikTok.
Wow.
It's just going on
And
on.
what do you think that causing that? What is the so the
You know-
suicide rates are going up? Is it because they see other people, teenagers,
Absolutely.
online, and they're trying to match that person? That the grass is always greener, neighbor's yard looks better. Like what is it that drives that depression,
Absolutely.
anxiety, and mental health issues?
I mean, social media helped with few things, right? Connection with others, communication.
Absolutely, yeah.
You're able to access to information much easier and faster. But the downside of it is definitely people comparing each other, people comparing others' masks to their real lives. The insecurity level totally went up, jealousy. But it's interesting. Even when I look at little kids, Aaron, who
Yeah.
have obviously don't even know the concept of social media, from the very early on, they have that jealousy and competition. No, I'm better. No, I'm better.
Yeah.
Mine is better. I have this. You.
And
It's
social
human
media is fueling
nature.
into that, right?
Absolutely. Yes.
It's fueling. Is putting oil to the fire.
So it goes back to we have to start early when our kids are very young, parenting and what's happening in the house, how you're raising because we cannot stop social media.
Absolutely,
This
yeah.
is only going to get worse
Yeah.
if anything. So what we can do is monitor the trust and respect between the parents and the kids are so important. And then, of course, the monitoring and not being such a helicopter parent, but being on top of, what they're watching, what they're doing, what are they learning, and all of that. Yeah, but the comparison and competition between people went up.
I also want to ask you about influencers, obviously content creators, are what creates social media in many ways. They're very important. And research shows that content creators have a higher percentage of mental health. They have 20% higher depression, higher burnout. In fact, 80% of content creators, professional content creators, say they suffer from burnout.
Burnouts, that's
Right.
the keyword, yes.
Burnout, which is kind of like an umbrella term for everything, right? All mental health. And I know that you also work with A-list actors and actresses in LA, and I think that profession is also very similar to content creators. So tell me, based on your experience, why is that the case? Why do they suffer more?
They're under attack more than average people. They're criticized more. They're under the spotlight. But also they're busier. There's just so much to do, so many things to do, and the pressure. Along with that, the fear of criticism. There are some celebrities, they do better than others because they just don't care. I have someone who's very famous. She says, I don't even read comments, or there are only certain people I go and I ask their feedback, and that's all I care about.
Very smart. I like that. Great
Yes.
advice, by the way. But anyway, keep going. Yeah.
But it really it depends person to person. What I found really interesting is that most of them are in therapy. Most of these celebrities are in therapy because they found it helpful. Just like in 10 minutes we learned about grounding, deep breathing, meditation, all of that. I mean, they get these tools and techniques. So I think the ones who struggle the most are the ones that don't seek help.
Right.
They don't seek help.
They don't see. Oh, they can't, or it's not affordable to them, right? That's also because when content creators are starting off, similar to actors actually, unless they make it to the top, initially it's really hard. They're
Absolutely.
barely paying their bills, so this is an additional cost to them.
Yes, I agree. And I going back to your point previously, it's not so socially acceptable to seek out for professional help. still this is like, we're doing much better, but it can get much better.
Tell me about, I know you also mentioned to me many times in the past how having a life purpose is extremely important when it comes to happiness, right? And mental health. So tell me more about that, about life purpose.
Sure. I mean, over and over, research showed that purposeless individuals are more prone to depression and addiction. And a lot of people I met that they ask, okay, like, I don't know what my purpose is. I don't know how to find purpose in my life. How do I make my life meaningful? And I ask them, what turns you on? And what I mean is not sexually. I mean mentally, emotionally. What turns your soul on? What makes you feel alive? And in order to find that out, you have to do a lot of self-reflection.
Mm-hmm.
Explore what you're engaging in the most. What are you watching the most? What are the things that interest you the most? Is it gardening? Is it politics? Is it religion? Is it sport, music? And do something about it. Pursue it. You know, they say there is no dream is too big and no dreamer is too small. Have you heard of that?
Yeah, I have.
And it's really true. So, but for us to make these dreams come true, it's extremely, crucially important to have self-discipline. And self-discipline means nothing but sacrificing your immediate gratifications. So if you're someone who wants to be happy every day, it's going to be hard for you to pursue your passion, because it's going to be a lot of work, a lot of sacrifice you have to make, a lot of it's a long journey. And that's why people just, straight go to drugs and alcohol, because it just makes them happy right away. But long-lasting happiness is not in sex, is not in drugs, is not in alcohol. It's in the purpose and meaning you find in your life.
And how does one person find their life purpose?
As I said, a lot of self-reflection about the things that interest you the most, something that turns your soul on. Mm-hmm. I know music for you, it just so what turns you on mentally and emotionally? Pursue that.
Yeah.
When you have the TV on, when it's politics, it turns you on, or when it's religion, or when it's sport, or when it's music, when, it's just, is it gardening? Is it cooking? But do something about it. Dream about it. Have a vision. Come up with a detailed, have a map and go detailed, and then just one at a time. You have to realize it's not going to happen in a week, in a month, maybe not even in a year. But honestly, the process of going through it has its own pleasure and joy. Me and my son, there's a game we play, and every time we become the king in the game, we get bored. We just get bored, like, okay, what do we do now? But in the process of trying to win, to be the king, you're like all excited and just turned on, like, it stimulates your brain.
Yeah.
What stimulates your brain, your soul? What turns you on?
Got it.
That's the way to start.
That's the way to start. Find something that stimulates your soul.
Absolutely.
I love that. Thank you so much, Jeanette.
Thank you, guys.
Thank you for being here today.
My pleasure. Anytime.
And we learned a lot in a short amount of time.
Yes.
So thank you for that.
I hope so.